All right, let's get right into it. For, decades, the big dream in healthcare was to ditch the mountains of paper files and step into this clean, efficient, digital future. And the key to that whole revolution? The electronic health record, or the EHR. But here's the twist. What happens when the solution that was supposed to make everything better actually creates a whole new world of problems?
Think about the last time you went to the doctor. Did you feel like you were really connecting with them, or did it feel more like they were connecting with their computer screen? That screen, that EHR system, it's at the very heart of one of the biggest paradoxes in modern medicine. Is it a tool that's making your care better, or has it kind of become a wall between you and your doctor? So to really get how we ended up here, we've got to rewind the clock a bit, back to a time when this digital-first world wasn't a sure thing. Before 2009, the whole idea of a fully electronic record, well, for most hospitals and clinics, it was still a pretty niche concept. But that was all about to change, and I mean fast.
Now, the really wild thing to see here is the pacing. EHRs have actually been around since the 70s. But for more than 30 years, getting anyone to actually use them was like pulling teeth. Even by 2004, you're looking at only 1 in 5 doctors in an office setting using them. There was no big push. No real reason to switch. And then, 2009 hit.
That's when the US government came in with the HITECH Act. And this wasn't some small program. We're talking about a massive $35 billion injection of cash into the healthcare system. And the goal was singular. Get everyone, and I mean everyone, to adopt certified EHRs and create this national digital highway for health information. The deal was pretty simple. Get on board, or, down the line, you're going to face penalties.
So, did it work? Well, to say it worked is a huge understatement. The HITECH Act didn't just nudge people along, it unleashed what you can only call a digital tsunami across the entire healthcare industry. The shift was more sudden and more dramatic than anyone could have predicted.
And this chart just says it all, right? Before HITECH, you had maybe 15% of hospitals using any kind of basic EHR system. 15%. Less than a decade later, that number shoots up to an unbelievable 96%. It was a near total transformation of how hospitals work, and it happened in what felt like the blink of an eye.
And this wasn't just happening in big hospitals. In doctors' offices all over the country, adoption just soared to 78%. So, on paper, this was a massive success. Mission accomplished. Healthcare was officially digital. But just under the surface of this lightning-fast change, some really serious unintended consequences were starting to bubble up.
And this is really where the story pivots. Because while the what, the digitization itself was a success, the how it was done created this deep, troubling paradox. The very tools that were meant to make care better started to cause entirely new kinds of harm.
Just look at this breakdown. The promise was so simple, so clear. Fewer medical errors, better records, improved quality and safety for everyone. But the reality for the doctors and nurses on the front lines? It was a daily battle with burnout, a constant storm of notifications that led to alert fatigue, and this crushing burden of documentation that, ironically, created brand new risks for patient safety.
Let's really talk about that human cost. You had providers feeling what's called moral distress, literally torn between what the software demanded and what the patient in front of them needed. Nurses were forced to come up with these clunky, inefficient workarounds just to do their jobs. And the patient's story, the real human narrative, it was getting lost in the maze of drop-down menus and checkboxes. All of this led to absolutely staggering levels of burnout.
This quote, from a nurse in one of the studies we looked at, man, it just says everything. The technology that was supposed to empower healthcare workers was instead making them feel like they were failing. It created a system that seemed to value data entry more than the very human act of caring for another person.
So what's the answer? Just junk the technology and go back to paper? No way. That digital highway is here to stay. The real solution needs a much more sophisticated way of thinking. It demands a new philosophy that helps us move past this whole technology versus caring fight.
And a name for that philosophy is Polarity Thinking. So instead of seeing this as a choice, either efficiency or care, Polarity Thinking encourages us to embrace a both-and approach. It's about recognizing that these two ideas, which seem like opposites, actually depend on each other to create a healthy, functioning system.
This image here is a really great way to visualize it. Think of polarity thinking as this big conceptual umbrella. It's not there to solve just one single problem. Instead, it gives us a framework for holding all these competing tensions,
like needing clinical alerts, but also dealing with alert fatigue in a constructive, healthy balance.
Okay, let's make this super concrete. Take clinical alerts. If you focus only on one side, cranking up the alerts for maximum safety, you get a bad outcome: alert fatigue. Doctors and nurses just start tuning everything out. But if you swing the pendulum all the way to the other side and focus only on reducing alerts to cut down on distractions, you get another bad outcome. You risk missing a critical drug interaction. The whole point is to find that both-and sweet spot right in the middle.
And, this whole conversation leads us to an even deeper question. This isn't just about designing better software or smarter workflows. It's about, can we build technology with a conscience, with a soul? It's about cultivating a kind of wisdom that can actually guide us through this digital age.
There's actually a term for this: Technomoral Wisdom. It's the ability to respond to the moral questions that technology throws at us, not just with better engineering, but with better ethics. And the key thing to get here is that this is about our character, not just our code.
So how do we get there? Well, it's about building virtues into our approach. First, humility, just admitting our tech isn't perfect. Second, empathic concern, designing systems that always put the human connection first. Third, justice, making sure these powerful tools are used to reduce health inequities, not make them worse by baking in biases. And finally, leadership, creating a culture where it's safe to point out these problems and actually work together to fix them.
In the end, this EHR paradox, it's not really a technical problem that we can just solve. It's a human challenge that we have to meet. It's asking all of us to look past the screen and think really hard about the character and the values we're building into our tools. So the final question isn't just for the software developers or the hospital administrators, it's for all of us. How do we find the wisdom to build technology that actually, truly cares?